Hello, today we're going to talk about erythroderma, also known as generalized exfoliative dermatitis. It's a scaling erythematous dermatitis which affects more than 90% of the cutaneous surface. The epidemiology is that males are affected 3 times more than females, and it's usually in patients aged more than 40 years. Pathogenesis is that there's increased skin blood perfusion, increased capillary permeability, temperature dysregulation, high output cardiac failure, which leads to increased metabolic rate, which leads to fluid loss, similar to burns, which cause edema, hypoalbuminemia, and loss of muscle mass. The etiology you can remember from ID scalp, which stands for idiopathic drugs, lymphoma, atopic dermatitis, psoriasis, seborrheic dermatitis, and contact dermatitis. The history, you need to obtain a complete history and of over-the-counter drugs, lymphoma, and Staphylococcus scaly skin syndrome. You can also find erythema, scaling on the flexus, pruritus, nail thickening, and a differential we have with these different types of dermatitis, such as allergic dermatitis, irritant, pediatric atopic, seborrheic, and stasis dermatitis. You can also have psoriasis as a differential and rheumatoid arthritis. The treatment includes wet dressings, topical steroids, systemic antibiotic if there's signs of infection, antihistamines to reduce pruritus, nutrition, and dermatological consultation. Nutritional wise, the skin is made of keratin, and keratin is a protein, so you lose a lot of keratin, and then therefore albumin is metabolized to replace that protein. So you have decrease in albumin, you have edema. You then need to replace this protein due to desquamation. You also need to educate the patients, empowering patients with knowledge of the underlying cause, of a good follow-up, healthy lifestyle, and better management of diseases. You can have red man syndrome, which is an idiopathic exfoliative dermatitis. A lot of drugs can be the cause of erythroderma, and 29% of erythroderma cases are caused by drugs such as ACE inhibitors, atropine, allopurinol, dapsone, fluoxetine, ketorolac, penicillin, phenytoin, sulfonylureas, vancomycin, warfarin. There's around 130 drugs that can be involved in erythroderma causation. Thank you very much.